Nurse Sherry here, and today we're going to be going over the IPPA assessment. So we're looking at inspection, palpation, percussion, and auscultation. So in inspection, what we're looking for here is we're determining things by our senses. So by objectively looking at the patient, so we could be looking for color of skin. Are they pale? Are they red? Do they have cyanosis, bluish tint around their fingers or around their mouth? We're also looking for smells. So you can smell yeast, you can smell, if someone had a GI bleed, that's a distinct smell. C. diff is a distinct smell. So different things you're smelling as well when you go in. When we think of a urinary tract infection, think of how their urine smells. It's pretty loud. It almost smells like ammonia type. So those are different things that we're doing with our senses. Also, like hearing. Are they coughing or gurgling, or are they making any sounds? Do you notice any sounds when they're moving body parts? Things like that. So we're looking at anything that we can see, right? Any kind of movement or texture. How are they sitting? Is their posture good? Are they shuffling when they walk? Is their gait steady? So these are all things we're looking for. Do you notice anything that's not symmetrical, right? So if one arm is leaning down over the other, or if I smile and only half of my face is smiling, then that also indicates some sort of paralysis. Could be Bell palsy, or it could be stroke. So different types of things we're looking for when we are observing for inspection. Okay, you can see lumps as well. And then we move on to palpation. So palpation requires you to touch the patient. Different parts of your hands are being used when you're doing this. Your hands are really good tools. So this is another reason why we should keep our fingernails cut, so we are not have fake nails. So we don't harm someone's skin. They harbor germs as well, so we don't want to be passing those along as well. You should wear gloves when you're palpating, because you might be around mucous membranes or areas that come in contact with bodily fluids. So when you're doing palpation, we're looking for, the feeling of lumps. We might be able to feel those. When you are palpating the abdomen, then you're feeling for borders of your organs, and so you can feel that different types of ways. I've had doctors that will have you breathe in, and then they'll stick their fingers under your rib cage here. That way they can feel the liver when you take a breath in. They can feel the border of it, right? So that can indicate if there's any inflammation there, if it's larger than normal, or maybe feel some sort of lump or something in there as well. So we're using a lot of touch with palpation, and we're always, just trying to find something that might not be normal, right? We also use it to check temperatures. If you do check a temperature, like with your kids or something, you should always use the back of your hand, never the front. But you might feel if your patient's warm, if they're clammy, right? You could feel that. If they have a fever or anything like that, that's what you're going to feel with your hands, right? And then the next one is going to be percussion. And percussion is used with one or two fingers, and you are tapping. You can check the picture out here. You tap a body part, okay? And so what you're looking for is you're going to press the distal part of the middle finger over your non-dominant hand firmly on the body part. While you're doing that, you're going to flex your wrist and use your middle finger of your dominant hand to tap quickly and directly. Okay, and you're listening for the sounds that it might produce. So when we're doing these, we want to use our fingers and our ears. So we're really looking at all of this. We're looking for any tender areas as well. It can tell if organs are hollow or if they are solid. So it just tells you different things, shapes and borders as well of your organs. And then auscultation. We listen to a lot of things, right? So when we're listening, we want to make sure that we're putting your stethoscope in the correct places. So when we're looking at the lungs, okay, so you're going to be listening to all those front and back, and you can see in the picture exactly where you'd be listening to those. You are listening for any signs of fluid, which we call crackles. It just sounds like crackling, and that's you can hear that at the base a lot of times, and sometimes the full lung. So you're also listening to diminished, or how much are you actually hearing? Do you notice any mucus in there? Is there wheezing? These are the things you're listening to when you are listening to your lungs. Then when you listen to your abdomen, we have 4 quadrants. So we want to listen to each quadrant and see if you can hear. It sounds like a gurgling sound when we're listening for bowel sounds. You can have hypoactive bowel sounds, meaning you're not hearing very much. You can have hyperactive, just might mean that you're hungry, right? But in order to state that you don't hear any bowel sounds, that they are absent, you must listen for full 5 minutes in each quadrant. So just make sure you're paying attention to that. Okay, and then we also listen to our heart, right? Well, there's different areas of the heart that we want to listen to. And so these are the areas right up here that you are going to listen to for the heart. You're going to listen to the valves, okay? Maybe somebody has a mechanical valve, you can hear that click. There's also pig valves, or just to hear what their valve sounds like. You could hear murmurs. Lots of different things and assessments you'll do in the cardiac system. And that is what the IPPA assessment is. Please leave comments, share, and follow if you have any questions. Always let me know. Thank you.